Hi, this is Dr. Alyssa Gall. Thanks for joining me on this special webinar on coronavirus. Keep up to date on other webinars and events at whole-life-medicine.com. Welcome to this coronavirus update and practical steps webinar. Of course, we are in the middle of a pandemic at present, and it is creating obvious disruptions in our lives, both minor and major. And I'm hoping to give you a sense of how I'm looking at this issue at present and give you an overview of this particular virus and how I would consider treating it. I have personally not seen anybody with this virus quite yet. And I would, of course, be totally happy to be on the front line. Unfortunately, in this province, we are being prevented from seeing anybody but clients who are in emergent situations. That means situations for which you would have to go to the hospital. So hopefully I don't have too many people in that position. But if you yourself have experienced this, I would love to hear from you because I would love to see what's been working for you personally. I actually don't think there's anybody amongst you that I've heard of anyways that I know have had this directly. Okay, so let's take a quick look. This is going to look so sciencey. So the SARS-CoV-2 virus, so this is a very small virus. It's a single-stranded RNA virus that's surrounded by an envelope made out of lipids or fats. And so this kind of virus basically has genetic material that can function very quickly in the cytoplasm of your cell. It doesn't actually need to go into the nucleus of the cell to infect you. It can basically just get across the first exterior cell membrane. And it can basically just directly start using your protein-producing structures in the cytoplasm to start replicating itself. So that's different than some of the more complex viruses that exist on the planet that actually have a much more complicated injection and nuclear interaction. So what this does is it actually makes the speed at which this virus can infect you quite rapidly, or be quite rapid, and it also can replicate itself very, very quickly. So it can spread within you more quickly than you'd think. It's so small, though, that really you're not going to stop it with like a paper mask, just so you know. I mean, yes, if you're coughing yourself and you have you put on a mask, it'll decrease like your respiratory droplet spread, but mostly you're preventing other people from getting it. You're decreasing it. You're not actually going to be able to stop the virus from crossing through that mask. This is a tiny particle. And so unless you have an N95 respirator, this is the kind of respirator that you wear in the hospital to surgery. So that's the kind of level of respirator we're talking about. When I haven't seen anybody wearing those to the grocery store so far. But that's the reason. This is the reason. It's a tiny little thing. So the virus infects you by attaching to a transmembrane protein. So this is for those of you who don't know much about cell biology, I'm just going to try and make this as simple as possible. And I've tried to pick a simple diagram. So hopefully it's clear when you look at it. But to infect a cell, and this is exactly what this little virus is supposed to look like, it has to attach to one of your cells. So it's the cells in your throat, it's the cells in your lung epithelium. It uses a spike protein, and you can see it's labeled here. It's like one of the little red proteins sticking out, and it's binding to this little green dot here that's on the cell. It's a little bit hard to see. Sorry, it's hard to make big enough to see really well. So what that is a transmembrane ACE2 enzyme. So on your cell membranes, or through your cell membranes, there's lots of different kinds of molecules. Like here, you're seeing this kind of blue blob there with not much detail. But the reality is there's a very complex system of proteins and sugar molecules that are hanging off the outside of cells. Part of those things are to identify the cell itself. Part of those are pores or channels that let things come from one side to the other. Sometimes there's receptors that are produced, like this one, that are producing a cascade of events happening within the cell. So in this particular case, this virus is binding on the cell membrane to a particular kind of transmembrane enzyme system. And this is often familiar as a term to people, like the ACE, because people have heard of ACE inhibitors or might be on ACE inhibitors. It stands basically for angiotensin converting enzyme 2. So the reason people have heard these terms before is because we use these agents to control blood pressure. They can be used in other things too, like they can sometimes be used like in scleroderma as an example, which is an autoimmune skin disorder. So lots of people have heard of ACE inhibitors or ACE2. They just don't know what that actually means. And in this, in the case of blood pressure, what this enzyme does is it actually changes how relaxed your blood vessels are. It's part of the mechanism of that. So obviously we don't have to talk fully about the full mechanisms of this, but this is a very common enzyme found on your cells, and it's very much found in your lungs, in your arteries, in your heart, but it's also found in your kidney intestines. So it's not exclusive to one zone of your body. Just so you, hopefully that's kind of a clear picture. Now, the question has come like, where is this virus coming from? Coronaviruses are super common as a group in humans. You get infected by coronaviruses relatively often, even if you don't know it. Most of the time, it's going to produce mild upper respiratory illness that looks like a cold. So one version of the cold can be a coronavirus. Coronaviruses are obviously also found in animals. In this case, this particular virus shares genetic traits with coronaviruses that infect bats and pangolins. Now, I did not know what a pangolin was. I think lots of people are probably in that set of circumstances. I found it was an extremely cute little being. Like, look at how cute that thing is. It does not look deadly at all. But apparently, people eat them around the world. And so as a consequence, they are in close proximity to human beings. They're kind of little harmless creatures. I guess when they threatened, they ball up in a little ball and they just look even cuter, like in a round ball. It's a kind of, I think they call it a spiny ant eater. It doesn't actually, I don't think it just eats ants. I think it eats a whole bunch of things. But the poor little thing, apparently it's quite delicious. And so in here we have a problem. The second creature that has similar genetic markers in this virus to this particular virus is the bat. And so there have been some theories about how perhaps this coronavirus came out of these populations. I think it's possible. But I also think that this past year, and I'm not the only person who thinks this, I have some great mentor teachers myself, one of whom is PhD in immunology that's quite involved at a high level in the American health system, and also is a teacher at one of the naturopathic universities. And it has not gone outside of our awareness that in fall and early winter last year, there was a ton of viral bronchopneumonia cases, probably more viral bronchopneumonia cases than I have seen in my entire career in a short window of time. I personally think that was already the coronavirus showing itself. It was very marked in terms of symptomatology. And so in particular, there were high fevers associated with this bronchopneumonia and a cough, and the whole duration of the thing was taking easily 3 weeks. Sometimes the cough was even taking a little bit longer to resolve. Now, it's possible that that coronavirus was a totally normal coronavirus in humans, and then it came into contact with animals in an environment that tends to have a lot of contact, which in this case was happening in the animal markets in China. Now, there's some debate because The problem is that you're trying to track viruses based on a limited amount of chemical markers in in the genome, basically for it. The science for that is actually relatively hard. Like you cannot easily track viruses around the world because you basically have to develop the identification and not necessarily the full test methodology, because we're using PCR tests for this. This is where you actually take the DNA out of the virus and you replicate it enough so that you can actually identify what kinds of genes are in there. It's both specific, but it is also to a degree a little bit crude. We also don't have the tests yet for antibodies, so we can't tell if people have been exposed to this virus before, because we don't know enough about it to make that kind of test. So at the present time, this virus is very likely going to continue to mutate. It's already apparently mutating to a less virulent form in China. In essence, there's two main forms, an S and an L form, and the less virulent form is now becoming more prevalent. So I don't know if normally these kinds of viruses, based on the action of the immune systems in the beings that it's finding itself in, it just starts to kind of fade in how virulent it is. So that's my theory anyways. There's been a bunch of people who've agreed with me. And so I'm pretty sure we've seen this in some way, shape, or form. But because we don't have the kind of testing that we would need to prove that, and I'm not sure that anybody bothered testing this bronchial pneumonia last year, because it just kind of seemed like it wasn't creating any acute respiratory distress or anything like that. So, or at least not enough to worry people. So it's a very interesting picture. And I think, though, ideally what I want you to get from that is that it's probably not been as acute or as massive as we think it is, in the same way that we think it is. And also, I want you to know pangolins are very cute. So who is at risk? I mean, pretty much everybody is, because it's a novel virus. So from an epidemiological model of spread, 80% of people, according to a model like that, are eventually going to be exposed. Of course, you could be exposed to something and never look like you've caught it, nor develop symptoms from it at all. It's just like any other transmissible virus, like the flu or like other coronaviruses, and the myriad other types of organisms that basically infect us on a seasonal basis. So just because it's widespread doesn't necessarily mean that it's going to get worse as a model. Again, like we're starting to see a decrease in its intensity as an infection, starting in China already. And so I think there's going to be a lot of people where the difference between whether or not you get it or not are going to be based on some of the higher risk factors. So basically, people like on ACE inhibitors are going to be at an increased risk. Now, will it be all of their risk? No, because people on ACE inhibitors already have cardiovascular inflammation and hypertension problems. Those who are over 80 are going to be more difficult to treat because they're not as vital. And so the immune system is not as vital. It doesn't kind of march on tickety-boo in the same way over time. It changes over time. It becomes less efficient over time. You become, more sclerosed as a person and less able to react in general. Of course, there's going to be some brilliant, people in this age frame who are super healthy, and, nothing is going to stop. Nothing like this is going to stop them. Also, people with diabetes and other types of cardiovascular disease are going to be at higher risk. That's, again, because there's already kind of a built-in metabolic inflammation across the board in a body that is experiencing that. And so, like we saw before, there's all of these receptors on these susceptible tissues. And in particular, these particular receptors are all over the heart and the lungs. And so if you're already having difficulty there, this is one of the reasons why it's going to be more intense in a person who's already experiencing that. Now, there's going to be one-offs in anecdotal reports and everything. I have literally been reading as many journal articles as I could stand. And there are not actually that many of them. And there's not that many really well-written ones because a lot of this is going to be understood retrospectively. From a science perspective, you can hypothesize, but you need time and observation to really take a look at what's going on. And it's not as black and white and cut and dry as sometimes we make it look. It's really not. It's a shame, but that's just the truth of the situation. So I'm sure you guys as a group are definitely going to be at less risk because you belong to me, and hopefully I've been teaching some good things in the last 20 years. So I'm going to bank on that a little bit. And we'll talk about some of those things that we can do in a sec. So I also want to talk about the viability of the virus because I've heard kind of conflicting information about this. And I think people are a bit confused, but I'm going to try and clear this up. Again, this is data that's coming from my own experience and with the people that I know well who are reporting back to me that have had some experience with this. Actually, the PhD in immunology that I know actually had the coronavirus. So that was awesome so that we could get a sense of what exactly those symptoms were like. And we'll talk about that in a sec. But basically, the survival of this virus is probably going to be between 3 and 24 hours on the surface. It really only stays in the air, aerosolized from like spit or respiratory secretions for about 30 seconds at normal room temperature. The colder it is, the more slowly it's actually going to drop to the ground. That's just based on the density of the air. The virus is really destroyed by anything that destroys lipid envelopes, and that's basically what we use soap for. So anything that cuts grease is going to damage the fat layer that coats the DNA on this virus. And again, they're tiny. It's very easy to interrupt a lipid envelope with soap. This is the reason why there are 6,000 signs everywhere you go about washing your hands with soap. And it doesn't have to be fancy soap. It just needs to be soap. And this is true, again, of lots of different viruses. It's and lots of different organisms, even bacteria. You can disrupt cell membranes. This is why, soap burns when it gets like up your nose or in your eye. You're actually disrupting cell membranes with it. Don't tell your children that in the bath, though. They are not going to be happy. They'd be like, yeah, you're damaging my cell membranes, mom or dad. But it is so much more effective than hand sanitizer because hand sanitizer is alcohol. It can partially dissolve fat, but it's actually not totally what it's designed to do. So the timed manifestation of illness, so this is the period where the infection becomes obvious, that is between 5 and 12 and a half days. So 95% of people who've been exposed and are going to be infected and show symptoms are going to show it in that time frame. So this is the reason for the 2-week quarantine post potential exposure. This is actually on the slower side for viruses. So normally, you would expect that because this is a quickly infecting virus, like why aren't we seeing it faster? Clearly, we're talking about like how quickly does it on a respiratory droplet, if it actually comes in contact with you, how fast is it in your lymphatics? Like 5 minutes. We're talking super fast. And yet most people are not showing symptoms until 5 to 12 and a half days. Like that's 2 standard deviations from the mean. So the usual time frame is going to be somewhere between 5 and 12 and a half, probably. So quite interesting. And this is one of the reasons because the immune system is not recognizing this very quickly, probably again because coronaviruses are super common. And, you can only, on a tiny molecule like that, you can only have so many, unique markers that the immune system is going to be able to recognize. And this one's kind of flying a little bit under the radar for that reason. Second thing, infection rate. So a normal flu sufferer will infect about 1.3 people. A person with coronavirus appears to be affecting about 3 people, so it is higher. But just to compare, like if you look at measles or whooping cough, the number of people that you would infect as a single infected person on average be 12 to 18. So it's the combination of this slow speed at which the immune system is recognizing the infection in combination with the slightly higher than average infection rate, making for increased spread. So it's this combo. And this is the reason why people are so panicked about trying to create these separation mechanisms. So in any ways, this is the reason for exponential spread. So in reality, if you wash your hands and your face, and you don't touch, stick your finger up your nose and spread it on things, would probably be going to be pretty good. And don't cough on people. So I also wanted to create some context here because, again, I've had so many people just being freaking out about like millions of people are going to die from this. I don't know. Not that I don't think it's possible, but I just wanted to give you a sense of like how people die, and how people die of respiratory disease, on average in this country. This is going to be different, obviously, from country to country. We could probably extrapolate close to our data to the United States, because there's many things we have in common. Some things they have a little bit worse than us on average most of the time. But this is how many people die per year in Canada. So the total number is like about 240,000 people. I'm using 2008 just because it was easy data to get a hold of in a table format. Health Canada is usually several years behind in health statistics because it takes quite a bit of time to compile this data from all the different sources. So the first biggest group of people who are going to die this year they're going to die from cancer. 72,000 people across all of the ages are going to die from that. So about a third of people. Another third of people are going to die from some sort of cardiovascular event. About a tenth are going to be from respiratory system disease. So things like chronic obstructive pulmonary disease, the impacts of long-term smoking. About 5,000 or about a 20th of all the deaths are going to be from an infectious cause. That's out of those, 3,500 of those are going to be flu. So just normal seasonal influenza, 3,500 people are going to die. So I want to put this in context because at the present time, we would need probably over 200,000 cases of coronavirus to reach the number of deaths in Canada we see from influenza alone at our current rate of death. And again, like I said, over time, our rate of death has been hovering under 2%. It's kind of gone, depending on the day, between like 1.3 and 1.8%. And part of that is just due to like inconsistent reporting. It's not reported exactly in the moment. But I think that should give you a whole bunch of context because most people are very surprised to understand here that we're not going to see as many people as quickly die of coronavirus than probably the flu. Now, that really depends on how many cases we get and how long the other strains that are less severe are going to come. But I just want to contextualize this now. I don't want to underplay the fact that this is serious, but I also want to educate you that there are other people, like we die of things all the time. How many deaths are there so far in Canada? Well, there's 16,000 cases. I think it's only about, where's my outbreak update? I don't always like to tell you how many people are died. $293 to date, 293. So we got a long ways to go before we even hit 3,500. 293 as of today, Carol. Of course, if you look at the US, the numbers for that are going to be higher. They have over 10 times as many people as us. But you have to take that relative to their population size, I think. So I just also wanted to point out the estimate of respiratory deaths due to seasonal influenza worldwide are 290,000 to 650,000 annually, depending on the year. So it just depends on how serious that flu is. And, again, the demographic changes a little bit depending on the markers on the virus and what your exposure has been like, all of those things. But again, context, 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 not minimizing the risk, but understanding what the true risk actually is. This is part of our problem, as physicians and as patients and as people who are involved in media. Like, the media is designed to make you freak out a little bit. That's the way our news is designed. It's to keep you excited and engaged and wanting to watch the news. And so I just find sometimes that the style of that has been so distressing to people, so distressing. And yes, Lynn, I'm not sure if there's possibly some immunity to this round. I'm hoping so, because like I said, it seemed awfully similar. The problem is that, again, we don't know what were the outside markers and binding. The binding was probably similar. It certainly wasn't the same in MERS, and it wasn't the same in SARS-1. So it's possible that the binding is slightly different. So, but we'll have to see. We'll have to see. We can't really go now back retrospectively and figure that out, probably. So the other question that's come up is there going to be a vaccine for this quickly? Maybe. How efficient it's going to be, hard to tell. Again, you're seeing so much mutation so quickly, and this is really kind of whipped around the world. And so it's been through all sorts of populations and temperature zones. And, those all have an impact. How a virus passes through, it always has an impact on what the final result will be. So I'm sure there will be some attempts. I don't know if it's going to happen soon enough to actually be of any particular consequence. I mean, the normal development time for a vaccine is not like 2 months, and it would need to be 2 months to really interrupt this cycle. And that's even on the off chance that it actually is going to do a really good job of that. So it's unfortunate, but it's true. Well, I mean, relatively speaking. We all know how I feel about that whole issue. So, any idea why men have higher infection rates, higher risks of cardiovascular disease and diabetes? Generally speaking, that's just normal in that population. It's protective to be a girl sometimes. Okay, so how can we help prevent infection? Like I already said, washing up with soap. Wiping down commonly touched surfaces with soap. Using essential oil diffusers with essential oils that are known to interrupt lipid membranes of viruses. I've listed a bunch of them here that are, some are common and some are not as common. The common ones here are going to be lemon, tea tree, eucalyptus, and then the less common ones, sometimes if you have a good essential oil collection at home, you're going to have some of these. But one of the best antiviral essential oils you can get is Ravinsara. This is different than Ravintsara. There's one that has a T and there's one that has an N. So Ravinsara is from Madagascar. It is kind of a weird smelling licorice sort of plant, extremely efficient as antiviral. So is the bay laurel, and so is niuli. So if you put those in close proximity to yourself, or even if you wipe a drop of that underneath your nose before going out, you're quite likely to be disrupting lipid membranes of viruses, as long as you don't shove it up your own nose and disturb your own virus, your own membranes. So like I said before, the virus is inside the lymphatics within 5 minutes of inhalation, whether or not you get it or not as an infection. Maintaining reasonable social distance is obviously one way of just decreasing respiratory droplet spread. Like I said, 30 seconds is enough for it to drop to the ground. So if you're really concerned about this, or you are at high risk, is you put a 30-second gap between you and the person that's walking around you. And please keep up your stress supports and diet and activity. If you're stressed out, I think honestly, this is going to be one of the major things that creates susceptibility. And we've been talking about this on our meditation group in the morning, how fear has a very immune paralyzing effect. When you go into your lower animal self, the fear, the one that's like irrational fear, you weaken your immunity 100%. So it's very, very useful if you can find a way to cope with your fear. And like I said, what we've been doing is the happy hour meditations in the morning, and then just recommending people stay on their normal supports. If there's things that they know that they tend to go into when they get stressed out, because lots of people are stressed out from staying at home and, being trapped inside or outside, or not being able to go like and have as much freedom as typical. So all of those are considerations. Sleep is incredibly important. So if melatonin is normal, it's going to improve resistance. And this has actually been, the evidence for this is already showing up in the literature on COVID-19. So kids are better off for this reason. They typically have much higher melatonin levels than an adult does. But if you're not sleeping 7 or 8 hours, you're going to increase your risk of any kind of infection, including this one. So exposure to daylight will also help for this reason, because it helps you to set your circadian rhythm. So spend your 20 minutes outside. That's all you're going to need to do. And it's always a possibility if your sleep has been not so great for whatever reason. If you can tolerate melatonin, it's absolutely fine to use, and it actually will probably be partially protective. So the dose on that would be between 5 and 20 milligrams. 20 is a higher dose. We use those doses when we have people with cancer or significant risks. And so, your average dose in the health food store will be 3 to 5 milligrams, and those are just fine. And if you are stressed, ask for help. If you're becoming too fixated on the potential for infection, like I said, turn off the news. Pretty sure, if there's something you need to know, it's going to just like lead to you anyways without watching the news. There's a certain level of just dread that I'm just seeing in people who are watching that too much. So turn it off. Can you inhale from the bottle of essential oil if you have no diffuser? Yeah, or just put a little drop on your top of your lips, Cindy. Thieves have some of the components, Patty. I was actually looking at my thieves oil the other day when I was looking at what I had in the house. It has in it cinnamon oil and cloves, some lemon, so the lemon is definitely there, some eucalyptus, and I'm just reading the bottle, actually just happens to be in front of me, and there's also some rosemary. So it has some of the components for sure. It's I'm not sure what the proportions are though in this, because it's proprietary, I think, what the proportions are. But I mean, if that's all you got, that's perfect. Let's just say that. Plus it smells so, it always smells to me like Aladdin and the thieves. I don't know if it has to do with that or not. So can an infected person that got over the infection be reinforced? Brenda's asking this. Reinforced, like, meaning, is it protective, Brenda? We don't know if it's protective. Possibly it is. I'm hoping it is, actually, because I think we've seen this already. All right. So what are the symptoms like? It really seems to start in general with tiredness, like that kind of muscle achy tiredness. And in many people, there's a touch of a sore throat. It's not the majority of it, but people will just seem to have a touch of the sore throat. But then the fever is coming on really fast and really high. And on average, that high fever is lasting about 3 days. And then at that 3-day mark, we're seeing a cough starting. So this is actually the moment where you have the highest inflammation. The danger in this particular mutation on the COVID-19 is that it's creating what's called a cytokine storm. So that's a kind of inflammatory immune reaction where you're pumping out a ton of molecules that are pro-inflammatory. And that's not outside of the normal. This is part of how you deal with like normal infections. However, the way that it's happening is that there's a kind of delay, and then you get this massive what's called a storm of these inflammatory molecules. So it's sudden, significant inflammatory reaction. It's actually caused by an immune response to do with NLRP3 inflammasome. That's something you probably haven't really heard of before. It's a common way of handling things. It's just that in this particular case, it's very over exuberant. Most healthy people are going to withstand that. Many unhealthy people are not. And again, it's the nature of the inflammatory reaction. This is one of the things that we saw is putting people at risk, is that they already have these inflammation conditions. So the cough then comes at this time frame, and the cough will last usually about 2 weeks if you don't do anything with it at all, probably. This infection is in essence a bilateral pneumonia. What that means is we're getting infection in the lungs, deeper in the lungs than typical. So bronchitis is right in the very top of the bronchus. Bronchopneumonia is the bronchus and the tissue surrounding the bronchial tubes, so the breathing tubes. And then pneumonia can usually, it's more sided. Usually it's predominant on one side, regardless of what kind it is. In this particular infection, if people have been really susceptible, it's been bilateral. So it actually means that the amount of oxygen exchange in inflamed tissues is substantially impaired. So you're actually almost getting a little bit of a false membrane in the lung, which is decreasing oxygenation. And if you already have a heart condition, you already have a lung condition, that's just going to make things more difficult. Now, these are the circumstances under which you would require mechanical ventilation, because it becomes so tiring to fight against the resistance in breathing. That's basically what we're talking about. So there'll be ventilation with assisted oxygen under those conditions. And so I know that, Carol's just saying here, do you feel like the bigger risk is the ability for hospitals to handle other emergencies due to this? Again, given the number of case counts and the number of people in ICU, it's there. It's certainly not in the moment overwhelming things. Is it possible that it could? I think there's a couple different ways to answer that. What we saw in China was we saw people being removed from their home environments and put into temporary hospitals with other people who were just as infected. And like we already were talking about, this is like easy to get in the air, easy to circulate, easy to inhale. And so, that's not a good set of conditions to have a pneumonia in. You're much better off, if it's at all possible, recuperating at home, not in a hospital system. Because the other complication of this, and this is one of the things that actually was most interesting to me when we first started seeing journal articles popping out of China, was that there really are not too many therapeutic agents that are having a great impact on either the symptom control of this or on the inflammatory control. And this is part of the reason why people are so concerned, is because, there's only so many tools in that box in the hospital. I do have a colleague, and I'll talk about him, his suggestions shortly, who's an anthroposophic physician who is actually in the ICU overseas and has treated coronavirus. And his suggestions, I think you'll find interesting and useful. But he would be like one in a bazillion, of people who actually are trying alternative things in this context. That's not the training of most people in this circumstance. And so if they don't have something already going, there's not a lot of flexibility to try other things. I think that there's actually a lot of room here for using things that will improve the circumstances. So I would like to, let's move on here. Okay, so let's talk about some of the things I've already suggested, and hopefully you guys are kind of following the blog or the updates that I've been trying to put out. The first thing I think, which is super cheap and easy and high efficiency under these conditions, would be NAC. This is a hugely good molecule to use for prevention and for active pneumonia because NAC is actually a precursor to glutathione, and glutathione is a molecule that really helps repair respiratory tissues. And so it's going to mitigate that inflammatory damage done by ACE-activated oxidative stress in your lung tissue. This is very good at keeping mucus within the lungs moving and not congealed, where you can get secondary complications. And a lot of the time, people who, and I'm not sure again, because I'm not seeing this in the literature, only some mentions are made of this, but people could also have a bacterial flu that's being superimposed on a viral one. That often is kind of the clinching factor when people are getting to the place where they're going to die. It's also a really great biofilm disruptor. NAC does have to come from a supplement, Lisa. It is not a naturally occurring molecule. The cysteine by itself is, but the N-acetylcysteine is not, which is a bummer. But this is, like I said, cheap and easy, and it works well in people who have pneumonia. It works well in people who have COPD. It works well in people who tend to have lots of infections from like asthma, anything where you have an issue like that. We also use it as a liver detox agent, mostly because, again, it increases the levels of glutathione really easily. So that's one consideration: cheap, easy, not hard to do. Next considerations. Vitamin D can increase soluble ACE2. Now, remember how I said that you can get the ACE2 stuck in the cell membranes? It actually turns out you can also make ACE2 that floats around in your bloodstream, so not attached to the cell itself. So if you have a bunch of soluble ACE2 enzyme floating around and the virus binds to that, then your immune system and your normal circulatory lymphatics can clean that out. So you're actually preventing it from binding to cells by making it bind with this soluble form of ACE2. And it turns out that vitamin D it increases soluble ACE2. So in theory, that can remove virus from the system. And again, I just want you to note the relationship to light and sleep. You get vitamin D from sunlight. And again, this is part of the rhythm of wake and sleep. And this rhythm is really important to maintain to prevent infections. Just in general, like that's not even just this one, but this one definitely has these pieces. One paper is showing positive effects from ascorbate. So ascorbate, oh, sorry, Tammy, it's about 5,000 IUs. Vitamin D is probably fine for that. In the absence of you knowing what your actual vitamin D level is in this moment, 5,000 it is fat soluble. You're going to store it. So you can do this now short term for a while and then drop it. But it does have this interesting effect. NAC, sorry, Lynn, is available from me or from a health food store, either way. So sorry, I said one paper is showing positive effects of ascorbate. So ascorbate is like the cheap form of vitamin C. It's just ascorbic acid. It is definitely working during infections. I don't think it's as much data for that preventatively, because in essence, what vitamin C is useful for, it's most useful IV in the middle of the cytokine storm, honestly. So most of us are not going to, hook up to an IV. But if you do get into a set of circumstances where you get quite ill, considering IV vitamin C is definitely an option. Next things that we know are having evidence for them right now, elderberry is definitely having some evidence for it to decrease viral load. This is true not just of coronaviruses, but across the board. And this is actually really well researched. However, Sambucus can increase inflammatory response. So if you want to stop it, if your symptoms become more severe. So it's great in the kind of like preventative stages, early stages, but then afterwards, I think reduce it. It's not going to reduce the symptomatology once you already have this going. Resveratrol is another supplement that you can use. That is a kind of extract from grape. We're using about probably about 100 milligrams of that in a day. It's usually sold as a concentrate. Oh, and sorry, maintenance dose for NAC. Usually they come in around 500 milligram capsules, so I'd probably do 1 to 2. And then, like I said, if you got sick, the therapeutic dose is usually 3 to 4, depending on the size of the person. So 1,500 to 2,000 milligrams on the NAC. And yes, Liz, that's a supplement only. Yeah. And then EGCG, that is a green tea extract. We often will use this for helping cell damage in cancer patients. The dose on that's going to be about 200 or so milligrams. Curcumin, which is the extract out of turmeric, has also shown some nice evidence so far. Actually, where it's shown the evidence is not specifically COVID-19, but it has shown it on other infections that have increased that inflammasome in the same way. So the paper on that is actually from about four years ago. It's not recent to COVID, but you can very easily extrapolate that it's going to help that inflammation reaction. And then quercetin. I've also been mentioning quercetin. Again, it is cheap and easy. It blocks ACE receptors. So basically, it's going to interfere with binding of the virus. And I would use EMIQ. That's a highly absorbable quercetin. And then you only have to take one of them. If you're going to just take quercetin powder, you're probably going to need like in the neighborhood of 2,000, 3,000 milligrams of it, because it's just not as concentrated when you get it like that. It's actually an extract from like the pith of citrus fruits, or there's like a bunch of different plants that have it in, but that's a common source for it. The other thing that's useful here, I'm just realizing, sorry, this slide doesn't have all these details on it that I anticipated. Sorry. So I'll type those out for you because sometimes I think I didn't give you the most recent one of this particular slide. So I will give you those. I'll let the slide presentation be, I'll send it to all of you guys if you'd like that. Now, we can also consider homeopathics. You know, some people are really into homeopathics, some people are not. Anthroposophically, it's being used in Europe right now to use phosphorus or ferrum phos preventatively in low potency, like in the 6C to maybe 30C range, a couple times a day. And what I was saying was about the fellow who's in the ICU in the anthroposophic community right now, treating some of these patients, is that they're using anthroposophic combination of stibium and arsenicum album. And of course, they are putting that in the IV because you can get sterile ampules of that you can use IV. I do have these remedies in my office because they're normal anthroposophic remedies, but in particular, they've been finding that that's actually being prophylactic and stabilizing respiration and actually preventing or relieving the ventilation needs and also shortening the course of the disease. So that's Dr. Sterner in Germany who's doing that. So I'm happy to supply those things to you. Those ones are a little bit harder, probably. The stibium might be harder for you to find. It's something that's often used in anthroposophy, but not really as common in the common homeopathics. Arsenicum album is pretty easy to find. And then we also have pneumoduron 1 and 2. These are the classic anthroposophic pneumonia remedies. And they can also be used if you just start getting symptoms. They're nice things to have on hand. And last but not least is bronchial syrup. I really found that last year when we had that horrible pneumonia going around, that actually works so well for the cough. And again, I haven't had that opportunity because there's just not enough patients for me to get enough corona patients. So, and like I said, I'm not suggesting you guys come down with it so I can experiment, but please let me know if you just want some of that. I'm in the office every day, Kaylee. So you can find me usually by phone or by email. I am still doing like online and video conferences or phone or video conferences for people who still have illnesses besides coronavirus. And so you're going to find me there. It's just that it's not as easy to just walk in because they've asked us not to do that. But I can make those things up for you. And we've been putting the things in our mailbox outside or couriering them or express posting them. So you just need to let me know. Oh, Lisa, thank you. Just don't get the coronavirus just to be my experiment, though. Okay. Now, I also wanted to review how to treat a fever, my friends, because some interesting things have also come out of this coronavirus treatment problems. And one of the biggest was that they were finding that antipyretic drugs like ibuprofen, so things that were controlling fever, were actually having a negative outcome on the survival of the patient or the symptomatology of the patient. Now, I don't think personally that's unique to coronavirus. That's basically true across the board. Viruses are killed by fever, just point blank. You get above a certain temperature in the body and viruses can't stand it and they die. So yay for that. Of course, you don't die of fever, just so you know, unless you get so dehydrated that you actually can't maintain, normal body or like you can't maintain the consistency of body temperature over time. And so this is one of the reasons why we say don't eat anything, drink tons of fluids and broths, don't become dehydrated with a high fever. If you're uncomfortable in a fever, there are easy strategies to help that. And I'm actually going to show you a couple of the common ones that we use naturopathically all the time that can decongest that feeling in your head of the head being too hot and distribute it all the way over your body. So please don't eat. Drink fluids, broths, because the instant you put something to eat into your digestive tract, your body has to use energy that it is using in the immunity to maintain the fever and try to mobilize immunity to digest food, which is an incredibly complex and energetically expensive process. This is why we say, starve a fever. The other thing you should do is empty out your GI tract if you start to get a fever. If you have magnesium at home, or milk of magnesia, or magnesium citrate, take a whole thwack of that and just get as much out of you as humanly possible, as quickly as possible. Usually we use about 2,000 milligrams of magnesium equivalent, and that'll work. Oh, sorry, we're having some people with connection problems. Just press reload. And it'll take you out and then in. There should be a button that you see on your screen. My button is a panic button. Your button is reload, apparently. So empty out the GI. Don't fill it up with food. Nobody's going to die of not eating for like a month. Like really. Most of us could stand to not eat for a little while. Myself included. So when you see a fever, please just stop eating. Only drink broths and soups. If for some reason you get really, really hungry, like stewed up cooked vegetables, like with more broth than anything, would probably be okay. You just do not want to overload your GI. It doesn't work well. And repeatedly, you're going to split the amount of energy that you have for one thing for the other. And please rest. Do not get up until you're well. There are going to be times, of course, where we have families and there's other things to do that need doing. I get that too. I am a single mom who runs a business, and I do not have any family support within 400 kilometers. So I totally get that. But at the same time, you have to figure out how it is going to be so that you can actually get enough rest to completely let your immune system go through the process. So don't watch TV, please. It takes a lot of energy for you to process what's in front of you. Really rest. Even if you can't sleep, lie down and just take her easy. Make your kids lie down with you. They probably wouldn't have you for as many hours as though until you're sick anyways. So the normal course of fever. Usually it's going to start with a headache and then you get a sudden drop in energy You're followed by chills. So when you see the chills, what that means is your set point's gone up and you're shivering to actually get the heat up to the set point. So when you're sick, your body goes, okay, we're going to jack the temperature. And then you shiver like crazy until you reach that temperature. The shivering act in your muscles actually generates the heat. And then with luck, you're going to end up hot. So if you're chilled in that process, by all means, hot water bottle, warm blankets, lots of layers. It's really important to just get through to the end of that and then get the heat going. And do not try and radically decrease your temperature once you get hot. If you suddenly change your internal temperature, it's very likely to lead to febrile seizures, especially in kids because they're so small body mass wise. It's much easier to quickly change their internal temperature. And I have literally seen little kids. I remember one, I will never forget this, early on in my practice. I had a kid basically with just a viral pharyngitis with a fever. And the kid was so hot that he really wanted to be out in the cold air, like it was minus 30. And so he was in the minus 30 without his jacket on, and because he was so hot. And it basically precipitated a febrile seizure because he lost a lot of body heat really quickly. And that's not to scare you. Febrile seizures are not like a precursor to epilepsy in any way, shape, or form. However, they're scary to look at and it freaks people out. So let's not do that to yourself or to another. And if your fever is concentrated in your head, what we usually use is the cold wet sock treatment or a lemon leg wrap. So the cold wet sock treatment is a classic, and I will give you the handout for this as well. I think what I'll do is just make a resource page that has all these bits on it so you can take a look at it. So if you feel like that heavy oppressive heat, what you want to do is distribute the temperature through your body. So you get a set of thin cotton socks, you soak them in cold water, you wring them out so they're not dripping, you put those on your feet. If your feet are cold, pre-warm them. Say if you're just a little bit chilled or your feet are cold, even though the rest of you is hot, put them in a warm foot bath for 5-10 minutes, and then put the cold wet socks on and cover that with wool socks or something thicker that's not going to lose heat, and bundle yourself up and you sleep in that. The distribution of the temperature will then actually go towards your feet. And even though you're not going to lose the overall fever, you're going to make it way more comfortable. And most of the time people will fall asleep, especially if they felt a little bit too hot in the head. And you'll sleep that off and dry off the cold socks. And then you may actually need to get up. If you still have the fever, get up, re-put the cold, re-soak the wet socks again, put the woolies back on, go back to bed. Most of the time, within a day of, or like a half a day of doing that, you're going to pretty much break the fever or make it way more tolerable. But you have not interfered with it. You've just let it go through its own natural process. And that works, honestly, best case scenario. And then there's, Patty, COVID can kind of affect the GI as well, but not like a stomach flu way. There are definitely receptors in the GI, and some people have reported some minor GI symptoms, but it hasn't been predominant. That said, when we use our Seneca Malbum as a homeopathic, if there are GI symptoms, that tends to smooth it out quite a bit. The lemon leg wrap is one that you may not have used before, but the reason why we like it is because the lemon actually will help you, especially if it's wrapped on your legs with a headache. So if the headache is really, not just the heat, but the headache is really getting you, doing a lemon leg wrap will work really well. So this is just I'll put the reference for this little book. It's an anthroposophic home remedies book. That's really cute. So I just stole the beautiful illustrations, but what they're showing is cutting a lemon in half, putting it in a bowl of water that's kind of lukewarm usually, and then slicing it underwater, basically all around, and then squashing the juice in. And this, when you do it this way, all the essential oils of the lemon are kind of caught in the water. If you don't have a lemon and you just have lemon essential oil, that's also useful. And then they show using a leg wrap, just soaking the leg wrap in that lemon infused water and wringing it out, and then winding it around the lower legs, and then putting woolly wraps on top of that. So that's another version of this. Usually they would keep this on slightly damp. So if it dries out, they just, again, re-soak it, as long as it's tolerable, but that will help a lot. Is there a risk of lifelong effect after getting infected with COVID-19? I mean, there's a possibility that you could do some respiratory tissue damage longer term. Nobody's probably going to know that for a while yet, I don't think. You got to remember that those are high turnover tissues as well. And so chances are good you're going to make some, relatively good repair to that damage. If you survive it, you'll do some good repair. I don't think anybody knows the answer to that, Laura. Maybe in somebody who already has a really significant pulmonary disorder, there might be. Even when we do have that, again, we can usually vaporize glutathione for inhalation in the lung. And we use homeopathics like that. So if I do have people with really severe lung traumas due to whatever, there are therapies that you could probably do for that. All right. And then how to relieve the cough and chest congestion. So if you have somebody who's got the high fever and cough and shortness of breath, dyspnea, shortness of breath, you can easily use a mustard plaster. And I've just shown you the diagram of how to do that on the left-hand side here. So you can use a thin cloth, and usually we take mustard seeds and grind them up and just mix them with enough water and a little bit of flour, usually to make a paste. And then you're going to put that in between the two pieces of cloth, and then put that mustard sandwich cloth directly on your bronchus. It has a counter irritant effect that brings good circulation into the upper bronchus, and that actually has been useful in the anthroposophic community for this infection. Second, you can use a ginger compress if you have somebody who tends to be more chilled, or they're just slowly progressing. The fever is not as high. And again, remember, fever is viral killing. So what you want is actually to gently encourage heat in that area. And fresh ginger grated and put it in a gauze wrap like this, and then placed over the chest will do a brilliant job of that. So hopefully I'm giving you some ideas of what you might do. Hopefully it's decreasing your fear level. Hopefully I've given you some context about this. And, I don't think we're going to know the full situation for a little while yet. But we have already seen, obviously, that the cases in China are changing already. And they will here too. I know they will. And if you need help or you're anxious, don't hesitate to find me. I'm around. As always, I've carried a pager for 20 years. If you freak out at 8 p.m., you can find me usually. With ginger essential oil work. It might, Lynn, just be careful because of the hot, it's hard to take that off. So you'd have to wash it off with something really good at washing off hot. I've made that mistake before with things like cinnamon essential oil. It's, putting that directly on the skin is going to be pretty irritating. Maybe you could use it as an inhalation instead of topically. Oh yeah, I want to see any COVID babies, please. Miss Laura, did you have a COVID baby? Awesome, get her to call me. All right, so I wanted to leave you with a bit of a funny last slide. I'm just thinking we should all get the mug, been there, done that. Got the souvenir mug after this is all over. And hopefully, I'm sure we're all going to do just fine with this. And we all have the skills and the tools, and we're all healthier than the average human being because you're all naturopathic clients. Let's face reality. You're awesome sauce. And so that's going to help you. So if you have an opportunity to, in the next couple of days, I will for sure put all this up on one page so that you can see all the details of it. Okay? So bless you all. Thank you so much for showing up. I have to tell you, it was crazy. This is the highest number of people I've ever had sign up for a webinar. It was 100 people. The closest we've gotten is the 70 that we did a webinar for food preparation, which apparently is also high up on the priority list. So if you're stressed out, come to meditation mornings every morning at 9 a.m. We do little meditations together and some discussion. Bless you all. I will see you hopefully in person or by video chat sometime soon. Drop me a line. I'll be at the office waiting. All right, guys. Love you all. See you. Bye.